This video will provide healthcare professionals with the basics on how to apply a negative pressure wound dressing. Clean and prep the wound area per your facility protocol. To achieve the seal essential for the best results with negative pressure therapy, you must clean, dry, and prepare the healthy skin surrounding the wound. After the area is cleaned, use the enclosed skin prep pad to swab the healthy, intact skin around the peri-wound where the outer drape will be applied. This preparation is important and necessary as it will improve the adhesion of the outer drape to the surrounding skin. Trim the foam dressing to the approximate size and shape of the wound. Do not cut the dressing above or near the actual wound. This will ensure that no small pieces or debris fall into the wound. Gently insert the foam dressing into the wound. Be sure to fit the foam into the wound shape to avoid any empty spaces in the wound bed. Also ensure the foam does not extend past the wound margin and overlap onto the intact skin around the wound. Some wounds may require hydrophilic foams to address tunneling and a non-adherent layer to treat exposed bone or tendon. Cut and apply the outer drape. The following is a basic technique for cutting and sizing the drape. First, cut the drape to a size that will adequately cover the wound. Leave about 3 to 5 centimeters of overlap around the entire wound to allow the drape to adhere to the surrounding intact skin. To adequately apply the drape to the wound, be sure to leave the 1, 2, 3 tabs on one side of the drape. Next, using the 3-tab pull system, remove layer 1 to expose the adhesive side of the drape. Apply the drape to the foam dressing and the surrounding intact skin. Start application from one end and smooth the drape down as you proceed to the other end. This will help to eliminate wrinkles, which can create leaks in the dressing. Remove tab 2, the dressing handles, and smooth down the remaining portion of the outer drape. After applying the drape, check for wrinkles and gently smooth down the entire drape to ensure proper adhesion throughout. Remove tab 3, the backing or transfer layer, to expose the back of the drape. Again, smooth down the drape thoroughly to eliminate any potential leaks. Cut a hole for exudate removal. Next, cut a small hole in the dressing to allow for exudate removal through the suction bell. Gently pull up the outer drape and cut a dime-sized hole in the drape at the center of the foam dressing. Be sure to remove the piece you cut out to avoid resealing or blockage, which could inhibit the removal of exudate from the wound. Some clinicians prefer cutting the hole in the drape prior to applying it. In either case, it is necessary to make sure the hole is centered on the foam dressing during application of the drape. Apply the Stingray suction bell. First, remove the backing layer on the bottom of the Stingray to expose the adhesive. To apply the suction bell to the hole previously cut in the drape, center the Stingray over the opening and smooth down to ensure proper leak-proof adhesion. Connect the canister tubes to the dressing tubes. With our basic series kits, the connection will be a friction fit. With our advanced series kits, the connection will be made with both tubes and our Sure-Lock connectors. You will hear an audible click. With the advanced series kits, be sure the same colors are connected, white to white and black to black. As a final check, smooth down the entire wound dressing and Stingray to ensure a leak-proof dressing. Turn on the WoundPro control unit to begin negative pressure therapy. The dressing should immediately show the effects of vacuum and shrink to a raisin-like appearance. If you have achieved an optimal secure dressing, the control unit will quickly reach its programmed pressure setting and hold that pressure. Should microleaks occur, the WoundPro is designed to overcome the loss of pressure by periodically cycling to compensate for the leaks. Do not discard extra drape material, as it can be used to help fortify the stingray connection or reinforce potential leaks that may occur over bony prominences. To relieve stress on the stingray in the event the tubes are inadvertently pulled during patient movement, tape down the stingray tubes a few inches away from the wound where feasible. If the WoundPro runs continuously to maintain the vacuum level, check the dressing for leaks and patch them with additional strips of the outer drape. Also check tube connections and that the canister is securely attached. If the situation is not resolved, you will eventually get a vacuum leak alarm. For more information, please consult your owner's manual or call your Pensar medical representative at 800-669-4757.